Children's Environmental Health Day. My name is Jena Losch, and I am a health communicator at CDC's Environmental Public Health Tracking Program. So whether you are a health professional, a concerned parent, a community activist, or running a nonprofit, we know that data is really important to our work in children's environmental health. A statistic can tell us important health information, like 20% of children in a neighborhood have asthma. But what does this mean? And is there a better way to communicate that? And how can we use this information to improve health in our communities? Well, that's what we are going to talk about today. How we get from data to action, and how you can use CDC's tracking network as a resource. So here's what I'm hoping you take away from the session today. That are empowered to use data to identify problems in the community, and that you can communicate those data using data visualization tools I will show you on the tracking network. I also hope that you will connect with state and local tracking programs who are passionate about children's environmental health issues in the community, or with us here at the tracking network. And I will show you some examples of how others have used tracking network resources to actually implement public health change in their communities, and hopefully you'll get inspired to do similar projects in your community. So what is the Environmental Public Health Tracking Network? So the tracking network is an online platform accessible to anyone that connects environmental and health data. So it's well known that our environment affects our health. So our program was developed so that we can have a robust data source, so we can better track environmental and health issues throughout time and see how these trends affect different regions of the United States. And so we can better understand how our environment and then environmental exposures are better connected to health effects. We also included important population characteristics that are also related to all these different health effects or are related to different environmental exposures. So that's a little bit about what tracking is. So now we'll be learning about how you can use the tracking network to identify these environmental health issues in your community and how to communicate that data using different types of data visualization. So you can actually follow along right with me. So you can follow the link at the bottom, cdc.gov/EPH tracking, to access all of the tools I'll be demoing today. So this is what you'll see when you get to our tracking website. And the first thing I'm going to take a look at is the info by location tool. So the first thing you see is a place to put your county name. So I'm going to put in my county, which is Fulton County, 30318. You can use your zip code or your county name. So this tool gives you a high-level overview of different environmental health issues for your area in this infographic type format. So first you can see some demographic info about your community. And then it goes into different environmental and health statistics. And there's an image next to some more information about how the environment and health are related. So this is a really great tool that helps introduce people to data, and it helps increase health literacy as well. You can also start to see where there might be some areas of concern. For example, it looks like there's a lot of extreme heat days here. And it also looks like there's high rates of asthma in Georgia compared to the rest of the US. So that is info by location. Now let's take a look at another tool, the heat and health tracker. So you can actually scroll over here and it should be right up here. So you can click on heat and health tracker. So this tool combines past historical data, real-time data, and future heat information. And it provides heat information related to extreme heat and also some easy to read infographics. This can be used to find specific heat and health information for your local community. So I'll put in my zip code again, Fulton County. So you can see how this tool can be used to see heat trends and how many extreme heat days there will be in the future. So it looks like this year we've had 36 heat days, but there's 58 heat days projected by 2050. And you could also do a deeper dive into the data. You could choose different vulnerability layers. And you could also choose different points of interest. So this information can be used to identify and protect vulnerable populations of heat-related illness, like children and student athletes. Next, we're going to take a look at the Data Explorer. The Data Explorer is our most powerful data tool of all, like our data queen. So let's click on it. And what you will see first when you first access it is this panel that comes up. And this is where you can pick any data that you want to take a look at. So first you pick the content area or subject you want to look at. There are so many different content areas to explore on the Data Explorer, but let's take a look at reproductive and birth outcomes. So next we could choose more specifically what data we want to take a look at in the indicator. And let's take a look at low birth weight. And next, we're going to take a look at the measure, which is basically these are all different ways of how we can look at the data in this data set. So I'm going to choose the average annual percent of very low birth weight of live singleton births over 5 years. So next, we're going to take a look at the geography type. So I'm curious to look at the national picture of low birth weight. So we're going to choose national by county data smoothed. So data smoothed means that if there's a low population in one county, it borrows data from neighboring counties so you can see better patterns. So the next step is geography. And this already has all counties since we're looking at a national picture. So next I could take a look at the years of data I want to look at. So I want to see how it's changed over time. So I'm going to pick all of the years. And let's press go. So we get back a data display that looks like this. It's the map is the default way to get data back on the Data Explorer. So you can actually open up another data set in the second view or second window over here so you can take a look at different data sets side by side. We're going to close this for right now. So since we picked all of the different years of data, we can actually animate this map to see how we see patterns change over time. So we go up here to play timeline. And we see how the years are changing up top. It starts from the year 2000 and goes all the way to 2018, which is the last year of data that we have right now. So you can use this map view, and the timeline view is really helpful to see how you can see how patterns emerge and see how the trends have changed over time. So this shows that low birth weight has been more prevalent in the southern United States for at least for the time span that we're seeing here. So maybe we want to look more specifically at this data and see maybe where in this area is most at risk or has the highest percentage of low birth weight. So you can actually find that information by going to the chart view. So this allows us to really pinpoint those areas that are highest risk, and we could do that by sorting the data. So we can take a look at, we can actually look at it for all years, but let's look at the most recent years for now. We're going to look at 2014 and 2018. And we can actually zoom in right here to see these are the top counties in the United States that had the lowest annual average percent of low birth weight. And this is averaged over 5 years. So we could see that Kahoma, Mississippi has the highest percent of babies born with low birth weight during 2014 and 2018. So you can actually export all of these charts or maps or tables. You can use it right here. Here's the little picture, and you can actually do image export as a JPEG or PNG. And if you want to share this query, basically you want to have someone else be able to pull this data up that exactly how you put it out, you can use this URL and you could share the data that you're looking at right now. So let's take a look at a few other features back on our map view. So maybe you want to see what's going on in your area. So you actually could go over here to our search bar and put in your address. I'm just going to put my zip code back in here. It pulls up Atlanta. And we can actually zoom in a little bit to see what's going on in Atlanta. So I could see Fulton County has 1.38% of very low birth weight babies. And we can take a look at different map options as well. So we can set our transparency layer so you could better see the map behind it. You could change the background layer as well, depending on what you'd like to take a look at. You can also add different points of interest. So maybe I want to see what public schools are near me. And then you can also do different overlays as well. So some of these are real-time data, like our surface smoke, current radar, and active Atlantic cyclones, which are hurricanes. So you can overlay that data onto any data set on the tracking network, which is really cool. So another interesting thing about these points of interest is you can actually zoom in on them and you could click on it and it will actually tell you information about that point of interest. So this is just a really quick overview that hopefully you could see how powerful of a data tool this is, and you could choose many different displays on the Data Explorer to help you identify areas that are at risk and how you could communicate this data in many different ways, such as maps, timelines, and charts. So I encourage you to use these different tools on the tracking network to basically explore all these different important health and environmental issues in your community. And you can use the different types of displays, like infographics, maps, and charts to better visualize data, understand trends, and then share your data visualizations and help communicate that data to many different audiences. So there are people all over the United States who are working on using environmental health data to improve health in your community. So if you have a project you're working on or are concerned about some environmental issues in your community, or looking for data on even more environmental and health topics, I encourage you to connect with your local tracking program. So CDC funds 25 states and New York City to have their own tracking programs, and many are working on children's environmental health projects. Even if your state isn't highlighted here, we also host fellowships and partner with many different organizations in almost every state. So you can connect with us, the National Tracking Program, and we can help direct you to a local resource. So armed with robust data and partnering with your local tracking program or other organizations, you can implement public health change in your community. We have so many success stories of how community members have used tracking resources to apply for and get grants for things like community parks. And then they've used data visualizations to educate residents and talk to community leaders about issues that are important to them. So here's a few examples. So Utah implemented a new recess guidelines that are based on air quality data. And Minnesota implemented new indoor tanning booth restrictions for children based on melanoma rates in teens and young adults. And California worked to get a law passed that restricts pesticide spraying near school sites. So all of these projects started with some data that showed there was a problem, and then concerned citizens partnered with nonprofits and worked with their local tracking programs, all to make some real public health change. So we would love to connect with you. You could connect with us on social media where we post new data updates, all of our success stories, and fun things like Track or Treat, which is a campaign where we have Halloween themed environmental health messages like the one you see here. And feel free to email me as well, and I can help answer any questions you have about the tracking program and connect you with local tracking resources. So thanks for tuning in and have a great rest of Children's Environmental Health Day.